Today's QA lecture is going to be about dashboards in healthcare. Dashboards are a new technology that are arising in many institutions across the nation. They are essentially a way for hospital employees to open information and see it quickly and at a glance. Today we're going to talk about the three most used dashboards in healthcare currently. The first is a clinical dashboard. A clinical dashboard would be one that could be found in any inpatient unit, as well as different clinics within an institution such as radiology or lab. Upon pulling up a clinical dashboard, you can quickly at a glance get a census of the entire unit, how many patients you have, what patients are the most critical, their average length of stay, and information such as this that would be great to be able to see at a glance. The second is a hospital dashboard. A hospital dashboard is something that is institution-wide and is mostly used by administration. When administration pulls up a hospital dashboard, they can see information about the whole institution, such as how many admissions were there in this particular time period, what their emergency room wait times are, income, spending, and a number of information that's easy for them to quickly glance at. The third is a physician dashboard. A physician dashboard is something that is specific to a physician who is logging in. It will pull up all of their patients, the number of patients they have, how their patients are doing, and also allows for messaging within the institution so that they can contact other physicians on their patient's care team. This is an example of a clinical dashboard. If, for example, the nurse manager came in the morning and wanted to see how the unit was doing when she was starting her day, she could pull up the dashboard for Unit 1. You can see here that this tells her how many beds they have available, how many beds are temporarily available, occupied beds. Can also tell you the number of days that a patient has been here, the length of stay. It'll tell you their discharge status. And it can also tell you how many patients are waiting to be admitted onto your floor. This is an example of a physician dashboard. This physician logged in and can quickly see to the left the picture of their patient. It can tell them their room number, what their diagnosis is, the medications they are on, and the other physicians on their care team. Can also quickly access their patient chart, which is now usually an electronic medical record. Can leave any notes that they need to remind themselves of something with the patient or that they need to share with other people. Oftentimes now in physician dashboards, they can also message other care providers on their patient's care team. Here's another example of a physician dashboard. Instead of seeing the specific patients, they can see a summary of the data for all of their patients combined. They can see how many patients are in for a myocardial infarction or a heart attack. They can also see that they have alert items to the side if their patient needs a medication, if something happened over the night and the nurses wanted them to know about it, they'll have alert items that pop out. You can send emails so they know how many unread emails they have. They can also see patient status changes. This is an example of an emergency room dashboard. Emergency room dashboards are usually found in real time, which is extremely important in a clinic that has a high turnover rate, such as an emergency room. The nurse manager could easily log in here and see that currently they have 49 patients in their emergency room, how many are arriving per hour. You can see how many are in beds, how many have waiting to be seen. You can also see how many are being admitted. Some of the most important information to gather from an emergency room dashboard can be found at the bottom of the screen. This is where it breaks the patient information down into waiting time. Since one of the main goals of quality assurance is patient satisfaction, it's extremely important to know the wait time for any of your patients, because we all know that patients who have to wait longer are usually not the happiest. I do not want you to confuse a dashboard with a trackboard. In your own research, you will find this vocabulary word pop up. A trackboard is some of the same information that you can gather from a dashboard. However, it's found mostly on a short-term basis. For example, in a specific area such as a fluoroscopy department, they might have their daily schedule on a trackboard where they can see what their patient's name is, what they're coming down for, how long have they been in their department. This information is not stored. It goes away throughout the day as the patients are completed. Dashboard information is generally kept and can then be reported and researched after the fact. Here you will find your assignment for dashboards in healthcare. I ask that you use the information in the lecture today, as well as some of your own research, to place a 250-word submission as to how you believe dashboards both help in a facility and may hinder in a facility. This information can also be found in the QA assignment section of the website.